Yeah.
Okay, so you all know me, so I don't have to do any introductions. Today we're going to talk about neurological based communication disabilities. And neurological can be the cause of a stroke, epilepsy, brain trauma, accidents, concussions, MS, all of these that you see on the screen, and many more disorders. The ones that I find where the patients are most frustrated are those with stroke, aphasia, and brain trauma, because many of them remember what they used to be able to do and are so cognizant that they can't do it anymore, and it causes a great deal of frustration with them. So the main three neurological damages that directly affect communication are aphasia, which you just heard about in the last Chesapeake Forum. And they have difficulty. There's so many different kinds of aphasia that if you've met one person with aphasia, you've met one person with aphasia. It's not something that can be put into a basket and put all together. The next is dysarthria, which refers to the group of motor muscular disorders that you see in cerebral palsy, you see after a stroke, and this is simply muscular. The other area is apraxia, which is more neurological. It is how your brain interprets what you need to do to create speech. So we're going to talk about those three, and we're also going to talk about Alzheimer's and dementia. So just to kind of give you a little idea, it really depends on what area of the brain is affected by the injury. Aphasia, as you can see, can affect a huge area of the brain. Apraxia, which we just talked about, is more in the motor planning area of the brain, and dysarthria is in the muscular movement. So a lot of the brain mapping and the studies that are coming out now really help with distinguishing between which areas have been damaged and how you can approach them therapeutically. So the main thing that you want to know is that speech is an overlaid function. And what that means is it's secondary to the primary reason that we have these aspects in our body. For example, your tongue is meant to assist in swallowing. It's meant to encourage your taste buds. Your teeth and your lips have to do with sucking, with mastication. Their primary purpose was not to speak. Your lungs, their primary purpose is for respiration, to keep you alive. They were never meant to be speech organs. And your vocal folds, which you can see here, were always meant to close off the area so that food and other things are not aspirated into your lungs. They were never meant to be vibrated on exhalation to produce sound. So when there is an injury to your brain, the first thing the brain is going to fix is going to be your things that keep you alive. Your ability to swallow, your ability to suck, your ability to breathe efficiently. Speech is a secondary, so knowing that, also, and now this will come up later also, in order to produce speech, it takes over 100 muscles. And it is the most difficult fine motor activity that you do on a daily basis. So let's talk about dysarthria and muscle control. Slow and slurred speech, rapid speech that's difficult to understand, difficulty moving your facial muscles and your tongue, inability to speak louder than a whisper, abnormal rhythm, strained or nasal sounding voice, monotonous speech, and uneven speech volume. Dysarthria is muscular. It takes that part of the brain that controls your muscle movements. These are the people who may have trouble swallowing. They may have trouble containing their drool. all of those different things. So what do we teach a dysarthric speaker to do? Speak slowly and loudly. Also, to start with a topic word, so the listeners know what they want to talk about, okay? Weather, I don't like it. So you as a listener are tuned into the fact that they're talking about the weather. And avoid talking when you're tired. As we all know, the more tired we are, the more difficult it is to do anything with our motor movements. So it's really important that people with dysarthria can understand that if they're tired, they need to give it a break. Pause frequently and use breath control. And that's really important in having them speak slowly and speak louder. And then check. Use shorter sentences and phrases. Check to make sure your listeners understand. And there is nothing wrong with writing or drawing if you're having difficulty talking. That's just another form of communication. So that's caused by damage to the nerves, the parts of the brain that control speech movements. Okay, eating, swallowing, drinking can also be an issue. Those are the things that are addressed first. Then speech is addressed. So what can we do? We talked last session about cognitive overload. So we're going to talk in a quiet area that has good lighting. We're going to make sure that you can see and they can see facial expressions. Not sitting behind a window that is glaring with sun. Not standing in front of a mirror. In a restaurant, making sure that you are in an area that absorbs noise and doesn't have reflection in the back. And pay close attention to the speaker when they're talking. Eye contact is really important for these speakers because they're working so hard to be able to get their speech out, and they're really working on these muscles. And I think of it as if I had to think about every single muscle movement that I make when I'm speaking, I don't know if I would have the patience to give a complete utterance. So these people are working really, really hard. So let them know if you don't understand, but repeat that you did understand. One of the things that you can do is say, I know you're talking about today's dinner, but I don't remember what you said, or I don't understand what you said about what you wanted. So they don't have to start from the beginning. You're giving them a point to start off from. Ask yes or no questions. They can nod their head. They can give you a thumbs up. I was with a person who had had a stroke on the chase boat for the log canoes 2 weekends ago. And he did everything through thumbs up and thumbs down. And we had some good conversations given the fact that he wasn't able to articulate what he was trying to say, given everything that was going around us. And always encourage them to write or point if they're having trouble. If they're working on getting the word out, we want to give them the time to do it. But if they get so frustrated that they can't, you can say, can you show me? And then they can use these other compensatory skills. So the treatment for this therapeutically is practice. Practice, 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 just like you do if you want to build up other muscles in your body. Because it takes muscles in your neck and your jaw, your tongue, your lips, your chest, your vocal cords, all of this, in order to improve the dysarthric speech, is to practice. We do a lot of moving your tongue here and there, saying words that use a variety of movements like pataka. So it really is practice. And even if you're treating these individuals therapeutically, it has to be practiced when they're at home and not receiving therapy. So it's important for those of us who are supporting them to make sure that they do their practice. One of the individuals I worked with, I talked to her grandson and I said, this is what you need grandma to do. And I showed him all the exercises. And she said, he bugs me every day, but she does her exercises and her grandson feels part of it. So, you know, use what's there to get them to practice. It's hard. It's really hard and it can be very discouraging, but it can be improved. Apraxia is a whole different matter. Apraxia is caused by damage just to the sensory motor part of your brain, and it's a neurological impairment. These people with apraxia can swallow, can eat, can produce whistle sounds, all of those things that are basic. Their breathing is fine, but their motor planning, that is a neurological act, doesn't allow them to organize their musculature to produce the sounds. So the motor skills really rely on motor memory. And that again is all about practice and drilling. And for me, as well as with dysarthria, I pick those words that are important to the individual. The names of their spouse, their address, the names of their grandchildren, the hobbies that they like. I'm not going to pound them to say words that aren't meaningful to them functionally. And that takes getting to know the family and getting to know what's important to the people that you're working with. So in this case, also cognitive overload or exhaustion have a very negative effect on the quality of the speech. So as a caregiver or person to support them, be aware of the times of day where they are less active or they need to rest. Oftentimes it's like from 3 to 5 in the afternoon. It may be in the morning. So getting to know the individuals and the patients and know when you can work on these things and know when you should just let it be. The other thing, and we'll talk a lot more about this, and we talked some last week about it, is engineering the environment so that these individuals can concentrate on their speech. If there's a lot of other things going around in the environment, they're not going to be able to concentrate and they're not going to be successful. The other aspect is that as we get older, we have less of ability to filter out external stimuli, especially noises. At least for me, it's noises. So make sure that there is not a lot of extra stimulation in the area when you are working on these things, because they take direct cognitive attention and focus. So, okay. So what does the apraxic speaker do? The same thing that you do for dysarthric. Slow down, breathe, think about the words that you're saying. And we as the caregivers give them clues. Let them know, oh, if it's apraxic, that that has that S sound in it. Do you remember what you do with that? You close your back teeth and you pull your tongue back and you smile and let the air flow out. So you're giving them some hints as to how to produce those sounds. And it's important that the caregivers know what kinds of hints the therapist is giving this individual so that they can carry through with that. And sometimes all it takes is, and they'll know, oh, that's that sound. So slow down, use short phrases, use breath control. That is huge. Pause after each statement, and again, manage those stress levels, manage that cognitive load. What can we do? Wait patiently with eye contact. And I know this was addressed in the Wednesday course, don't fill in the words for them. Let them try to say what they're trying to say. One of the things that I do is if I know that a patient, what the patient is trying to say, I'll give them the initial sound. Like if they're trying to ask for salad, I'll go, and a lot of times they'll just come out with the word salad. One of the main rules is the 13-second rule. And this has to do when there's a neurological challenge. When you ask a question or give a direction, pause and be silent for 13 seconds to allow the individual to take in the information, organize their brain on not only what they want to say, but how they're going to say it, and then be able to express it. 13 seconds feels like forever, but it gives them the time to reorganize whatever they need to reorganize neurologically. If you interrupt and repeat your question, that 13-second process starts all over again. So now you're adding another 13 seconds to their processing skills. You're also adding to their cognitive load. The other thing is, don't change your direction. If you know that they understand what you're saying, say it the same way. You use different vocabulary, different intonation, that process begins all over again. So it's very frustrating for someone who has neurological damage when they're not given the time to coordinate everything that needs to be coordinated neurologically for them to respond. And it's very hard for us as the caregivers not to jump in and give them support. But if we do that too quickly, you are not going to help them. You're going to make it even more difficult for them. And then keep your questions simple. Ask yes, no questions. Ask close-ended questions. Not what would you like for dinner, but would you like meatloaf or chicken? You know, giving them choices that are short, they can understand, they can neurologically coordinate how they need to respond. The other important thing is never talk down to them, because this is not, it does not affect their image of themselves and their knowledge of who they are. And I think I said in our last session, I had an individual who came to me after she quite verbally, in her own way, fired her last speech therapist. And after we had a few sessions, she managed to tell me she liked it because I didn't call her honey or sweetie. They don't like to be talked down to. And that's really important. I call people honey and sweetie a lot, but not with my patients. So now we're getting into aphasia, which you learned a lot about on Wednesday. It's very common. It results from damage to the part of the brain that processes language. And you saw in that first slide, it can damage a huge area of your brain. It can be receptive, what you understand, or it can be expressive, or it can be both, which is called global. There are many different kinds of aphasia. The treatments for aphasia depend on the individual, the site of the lesion, and the extent of the lesion. So those and whether or not they have good cognitive reserve. So it's something that you'll have for the rest of your life because there is damage to that area of the brain. It's not curable, but you can make progress with the use of neuroplasticity, which I think that you all listened to on Wednesday. It's very common in people 60 years and older who have suffered any kind of brain damage. And it's typically on the left side of your brain. So it can also be, there's another form of aphasia, which one of my patients had, which is called progressive aphasia. And that is a progressive neurological disease. And that is treated completely different from how you would treat what I would call a typical aphasic. They have difficulty in all aspects of language, understanding and expressing, reading and writing. So it affects everything. So the two main areas of aphasia are Broca's and Wernicke's. They're in different areas of the brain. Brain mapping can really help us with the diagnosis and give us some information on how to treat the individual. But overall, each one is different. Each patient is different with different skills and different reserve. So that comes to neuroplasticity, which I think you heard a lot about on Wednesday, but it's something that we don't want to ignore because it's very, very important. So in neuroplasticity, your dendrites right here, these are the axons, here are the dendrites. Okay, so they take in the signals from other neurons and they transmit them to the axons, and the axons transmit them to other neurons. If you don't stimulate your cognition, your physical exercise, the dendrites are going to atrophy. If you vigorously stimulate your cognition through learning, through doing exercises, you're going to stimulate growth in the dendrites. The thing about aphasia is, and where the site is, the area of the damage is very specific. And what you're trying to do therapeutically is you're trying to teach the surrounding area, the area that is still healthy, to perform the functions that the damaged area used to do. So it's really important that your body, your neurological system gets reorganized. This neuroplasticity is how stroke patients can regain skills. So it really depends on how quickly they get therapeutic services, the damage area, the extent of the damage, and us as caregivers in how we try to stimulate their ability to communicate. Here's another picture of the dendrites. I think this just is fascinating how the brain works. And here the dendrites have atrophied from lack of stimulation. And we talked in our last session about, is that wind too loud for you guys? Okay, good. We talked about how you can lose skills for hearing if you don't stimulate your hearing, if you don't wear your hearing aids all the time. You can start to lose the dendrites, lose that connection. The more you stimulate your hearing, the more the dendrites grow, and so the more that they will be able to work with your neurological system to improve even a basic function as hearing. Not to mention the functions of communication, which again are secondary. They're secondary functions. So how do you strengthen it? Try something new. Do exactly what you guys are doing. You know, be involved in a learning activity, learn a different language, take dance classes, take up a musical instrument. Do anything you can to stimulate your cognition and mix things up. And I've tried to do this. You really have to concentrate, like using your non-dominant leg to start up the stairs, or your dominant hand to eat or brush your teeth. That's really hard. Yep. Yeah. It's really hard, but it's really good for your brain. It's great exercise. Turn off the GPS and see if you can get there on your own. That's a challenge for me. Yeah. Turn off, exercise in a different way. I've just started doing high intensity water exercises, which are based on 20 seconds of activity, 10 seconds of rest, 20 seconds of a different activity, 20 seconds of rest. And that I can tell after I've done that, I did it this morning at the Y, I just feel so more focused and on target because I've really stimulated my brain in an atmosphere that's not going to put any tension on my body. Take a trip, be social. Even if you don't want to be social. Go, when somebody invites you to do something, go and do it. So let's see, where was I going with this? Oh, this is cognitive reserve. Okay, so the more active your brain is, more you're going to have in reserve. When I was listening to the Wednesday broadcast, it struck me that he was a perfect example of cognitive reserve. This was a man who was continually learning, who kept up his pace of learning. He had enough cognitive reserve that the damage that was caused to him was less than it might be for someone who did not have that cognitive reserve. So it's another one of those use it or lose it kinds of things. You have to keep learning what you guys are doing, and keep experiencing new things. So don't get stuck in the box. So what's cognitive overload? And this is a big one. Look at information processing theory, okay? The whole theory that you talk about with your children and their learning and your grandchildren, that there's working memory for what's coming in right now, and then there's long-term memory. Someone with aphasia or dementia or Alzheimer's have better long-term memory than short-term memory. And it depends on inside the complexity of the new information. If you go to the doctor and they're using all these medical terms, you are quickly going to get overwhelmed. And then you're going to shut down because the cognitive load is too much for you to handle. Extraneous is what our environment is about. Distractions, stimulation. You want to reduce that extraneous information so that you can use the best of your cognitive skills. And then the cognitive load is also the processing of new information, giving yourself time to process that, think of it, use it, and then retain it. So essentially, when we take in sensory information, we encode it in our memory through a multi-step process. We can then retrieve this information from our long-term memory. But if you're exposed to too much, your working memory is going to shut down, and your brain does not get a chance to make that information part of your long-term memory. So in all aspects of any kind of communication difficulty, cognitive load is huge. So keep things simple. You don't have to write a paragraph when a bulleted list of 3 things can be sufficient. Reduce your stress, easy to say, and declutter your environment. And that, for me, I'm naturally one of those people. I can't work in my therapy room unless everything's put where it needs to be, because if too much clutter is too distracting for me and increases my cognitive load. So how can we help? Make eye contact. Make eye contact and be consistent, and use 13-second rule. Decrease the background noise. Turn off the TV, the radio. If you're at a party, go and talk in an area that isn't as crowded. Use your voice at a normal level, unless the person has asked you to speak louder. So don't speak slowly. Don't exaggerate your speech. That requires a whole nother process neurologically. So you're adding to the overload by doing that. Talk in simple, concrete sentences, but don't talk down to the person. And again, give them time, give them time. Sometimes we forget. We forget to listen because we want our message to be heard. So it's really important. I used to put around the classrooms that I was working with, I used to put pictures of this right at the eye level of the teachers and the aides to remind them to just listen and let the person work it out. Another thing with aphasia, go to the National Aphasia Association and get an aphasia ID card. If you have something like that, you can go into a restaurant, you can show it to the waiter, and that will indicate to him that he's going to give you a little more processing time in a variety of places. Get that card. Keep your questions and responses simple. Yes, no. Downplay any errors that the person may make. I have a patient who she just can't get a grasp of the pronouns. I know she's talking about her husband, but it's a she. I'm not going to waste her cognitive ability and our time correcting something so insignificant. So don't let some of that stuff go, because they're not going to get it right, and you're just going to frustrate them. Encourage circumlocution. Circumlocution is talking about something so that the listener can figure out what you're talking about. I want that, that yellow fruit, that it's long. Oh, you want a banana. And that is going to facilitate not only their cognitive skills, but also their ability to find the words that they want. And once you get it, once you figure out what they're trying to talk about, the smiles are huge and they feel like they've been successful in communicating. So let them talk about it. Don't interrupt and give them the word. Even if you, into the description, you go, oh, I know what they're talking about. If you give them the word too quickly, they're not going to be using those circumlocution skills to be able to find that word themselves. So it's all about waiting and letting them do the most that they can without pushing the window too far and challenging them beyond their abilities. And that takes knowing the patient and knowing the family. Don't shield them from normal activities, but give them the choice of whether or not they want to attend. And try to involve them in the decision making. I had an individual who kept telling me, don't ask, don't ask. And what he was trying to tell me is they're not asking me what I want. They're talking about his condition in front of him like he's not there, which is extremely irritating, and they're not asking his opinion. So, it's important that they retain some of their self-image. And encourage, don't be overprotective. That's the other thing. And it's really hard because we want to take care. We want to be there for them. How are some other accommodations? Oh boy, okay. Use visuals. Typically, people with aphasia, dementia, and Alzheimer's can understand symbols or pictures better than they can speech. Instead of talking on the phone, use FaceTime, use Zoom, use gestures. I use gestures all the time with my individuals. And I can just go, and they'll go, big, yes, big. So, give them that accommodation so that they can utilize their skills. 13-second rule, there it is again. Don't shout, speak at your normal voice. Don't talk down to them, and cut the tasks into smaller pieces. Here's an example that I have of one of my clients' sessions. He loves coming to therapy, and he likes to know that he's going to accomplish all of his goals. So the first thing we do is we call his grandparents on FaceTime. When that's done, I take it off. The next thing he's going to do is work with his iPad. Take it off. The next thing he's going to do is work with a patella story, which I'm going to show you all of those. And then the last thing is to work on his communication book. So I have taken the session that I know he's anxious about because he wants so badly to make progress. And he wants to know that he has hit all of the targets in one session. So this little visual reminder helps him to recognize that he has accomplished his goal. And it's so simple. He also uses it when he talks to his grandparents, when they ask him what he did in therapy, and I'll show him, and then he can say, oh, I worked on my iPad, or as much as he could verbalize that. So there's another example, and this is, okay, come back there. Another patient I have that had progressive aphasia. She had enough intellect left to know that something happened, something was wrong, and it really bothered her that she didn't understand. Now, she had a progressive neurological disease, but at the time that this disease started to really impair her communication, she also had a fall. So I talked to the family and I said, look, is it okay with you if I explain her condition to her so that she can understand it? Because understanding a progressive neurological disease is very difficult. And they were all for it. So this is what she had in the beginning of her book. I had a fall and I hit my head. Now I have aphasia. And this is all, and I'll show you this later, this is in a storybook on the iPad that speaks. And she really liked it that I highlighted the area of her brain. And she'd be like, oh, it's right here. And then I put in, I hurt the part of my brain. She loved this slide. I know what I want to say, but it all comes out wrong. It is frustrating. And she would always laugh and point at that picture and say, yes, yes. So here I am validating her frustration, but also trying to give her some understanding of what the heck is happening to her. And then, why are you coming to therapy? I want to remember the important things. I want to remember my grandchildren. So to make it graphic and to give them some understanding to the best of their ability as to what has happened to them. So dementia and Alzheimer's. Okay, I think we all have this. I know I do. And where am I? What am I doing and where am I? And, you know, the distinguishing thing they always say, if you forgot where you put your keys, that's normal. If you forget what you do with your keys, that's dementia. So it's a group of symptoms and it affects all aspects of your cognition. This is not something that you can do a brain map and say, there's the damage. This is global damage. So, whoops. Alzheimer's is different from dementia. Dementia has many, many different causes, including some of the things that will cause aphasia or dysarthria or apraxia. So issues like vitamin deficiencies, some medications, growth in the brain. Dementia can be sometimes reversible, depending on the cause. And it certainly can be amenable to therapeutic intervention and support staff. Alzheimer's, on the other hand, is a progressive neurological disease. And it affects what they feel, what they think now, and it changes all the time, is that there's a plaque buildup that interferes with the neurological synapses connecting with each other, and that is progressive. It's irreversible. There aren't any drugs that can cure it, no matter what you see on FaceTime. But what we can do as caregivers and as therapists is to slow the process by repeating and repeating information and giving them the information they need to know or they want to know. We need to know what's important to them and then work on that. And I'll show you a lot of different ways. I thought, a friend of mine sent me this, and I thought it was so on target. If I get dementia, don't argue with me. What is true for me versus what is true for you? If I get dementia and I'm not sure who you are, don't take it personally. My timeline is confusing me. If I get dementia and can no longer use utensils, don't start feeding me. Instead, switch me to finger food diet and see if I can still feed myself. If I get dementia and I'm sad or anxious, hold my hand and listen. Don't tell me my feelings are unfounded. If I get dementia, I don't want to be treated like a child. Talk to me like the adult that I am. If I get dementia, I still want to enjoy the things I've always enjoyed. Help me find a way to exercise, to read, to visit with my friends. If I get dementia, ask me to tell you a story of my past, because that's what they can remember. If I get dementia and I become educated, take the time to figure out what's bothering me. If I get dementia, treat me the way you would want to be treated. If I get dementia, make sure there are plenty of snacks for me in the house. Even now, if I don't eat, I get angry. And if I have dementia, I might have trouble explaining to you what I need. If I get dementia, don't talk to me about me as if I'm not in the room. That's a huge no-no. If I get dementia, make sure I always have my favorite music playing within earshot when appropriate. If I get dementia, I like to pick up items and carry them around. Help me return those items to their original places. If I get dementia, don't exclude me from parties and family gatherings. If I get dementia, know that I still like receiving hugs and handshakes. And if I get dementia, remember that I'm still the person you know and love. I thought that was really impactful because it hits on all of those things that I've seen in my practice that are emotionally damaging to people who are having communication difficulties. And just to be reminded, they don't have to be perfect and they don't have to be correct. So it's how you respond to them. They're easily overwhelmed. Anyone with any neurological condition is easily overwhelmed. Like I said before, the filters that we have to block out the sound of the wind, the sound of the chimes behind me, weaken with age. And so they're taking in this sensory information at the same level as every other sensory information, but they don't have the ability to filter it out. So that's something that we have to be aware of. They feel helpless, and their sensory changes they can't always explain. Many times as your brain ages and changes, your taste buds change, your olfactory information changes. And what you used to love to eat tastes terrible to you now. And we'll talk a little bit more about that. But never take for granted that you know what they want and give them every opportunity to express what they want. And, I have caregivers who've said to me, I know what she likes. You know what? She has a right to tell you what she likes. So the symptoms include memory loss, of course, finding the right word, which you can hear as it's called word retrieval. They know the word, they know what they want to say, but they can't retrieve it. It's so frustrating. My patient who would look at pictures of her grandsons, who she loves dearly, and call them a name that is not even close to their name, and she knows it. That's not it. No, that's not it. That's got to be so frustrating. Reduced ability to organize and plan and reason and solve problems. And we as caregivers need to help them with that. Not do it for them, but help them to figure those things out. Coordination and motor functions can go down. Eating can become a difficult task. Maybe your vision is not as accurate as it was. Make sure that they go to get a good visual checkup. Many people with dementia have reported they have like a metallic taste in their mouth when they're taking in food because they have a decreased sense of smell. So it's important for those people that we investigate their diet and find out what spices, is it hot? Is it something that needs to be a little sweeter? You know, what are they going to eat that will overcome that sensory change? Typically, food that is at a normal room temperature is not something that they want. They either want it really hot or really cold because their sensory, their neurological senses are delayed. So they need that sensory input. Agnosia is not being able to find the word. They have what's called emotional fragility. Their emotions are right there, and they can't sometimes control expressing them. They may be perfectly fine 1 minute and crying the next because their emotions are so fragile. And that is something that's when you just give them a hug or sit next to them or pat their knee and let them get it out. And the other thing is most of the communication difficulties occur in the frontal lobe or the medial area of the brain. The back area, which is called the amygdala, is what we call your animal brain. That is the one that does the fight, flight, or freeze reaction. Many times you will see people that have these neurological challenges overreact to a situation, and that is not because they don't have control of their emotions. It's because the amygdala, that part of their brain, is more functional and stronger than their frontal cortex, which is where they do the problem solving, where they look at the situation and go, okay, it's smoke, but it's coming from the grill, so it's okay. So all of these things are affected, and all of these things are expressed through their emotions and understood by us really observing what's going on, not the behavior, but what's underlying the behavior. So, solutions. My brother had a brain trauma while he was serving in Vietnam. He has absolutely no short-term memory, but he has great long-term memory. So what we said for him is write it down. Write down what you did. He has good writing skills. And I will call him at night and I say, what'd you do today? And he'll get out his list and he goes, well, I took my medicine and I made eggs for breakfast. Now, if he didn't have that checklist, he would not be able to tell me what he had done that day because his short-term memory, his working memory is damaged. But by using this simple tool, I'm giving him the opportunity to be able to recall that information and relate it to a simple question that we all ask everybody, what'd you do today? When you get on the phone with your kids, with your grandkids, what'd you do today? So that's huge. We talked about the olfactory system. Work around that, try different recipes, try things that are going to be available and be enticing for them to eat. Weight loss is huge as we age, and we have to be very careful that people who have these kind of challenges are nutritionally sound. So just because they used to love fried chicken doesn't mean that they still love it. And that's going to take us trying to see what they can do. The other thing you could do is if there is, now my brother has an expressive aphasia as a result of that trauma. If they have a receptive aphasia, and I don't know if you can see this, make a visual checklist so that they're more independent. So maybe I have a picture of the pills. First thing I do in the morning, I look at my chart, there's the pill, I take my pills, I check it off. Okay, the next thing I do, I'm gonna do my yoga. So, giving them the visual supports that are going to let them be independent. We may have caregivers who say, okay, now it's time to take your pills. Okay, now it's time to do yoga. The individual becomes dependent on that person. And what happens? That person leaves. They get a new job. They have a baby. They're taking maternity leave. If you make it visual and consistent, you have got a tool that you have given them that will never change and will never go away, and they can take it with them wherever they are. So make it visual. Let's see. Make sure that they're in their comfort zone. And I'll give you another example with my brother. Because of the brain trauma, he really has his safe place. His safe place is in his home, where he's got his dog, he's got his pool, and he feels like he's in control of the environment. Last Christmas, we had a huge family reunion, and I'm talking 5 siblings who all had kids, whose kids had kids. There were like 23 different families there. And we really wanted my brother to come, and he was really nervous about it. So my sister brought him a red chair, and she took it over to her house and she said, look, Jimmy, this is your chair. When you come to the reunion, this will be your chair. And you can sit there and we will come and talk to you. And he walked in and he looked around and he went right for the red chair. Now, my sister was smart. She put it in an area that was relatively quiet, but that he could still see the things that were going on. So what she did, without even knowing what she was doing, was giving him a safe zone in an environment that he wasn't used to. And those are things that sometimes we don't think about. And sometimes when I was talking to him, I said, oh, you're sitting in a good place. Go, got my red chair. That was his safety zone, which allowed him to participate in a family reunion, which otherwise he would not have been able to do. So recognize their safety zone. Visual perception, use large print. And this is the weirdest thing that I learned. When you're giving people information visually, this is the color you should use. I never knew that. This bright green color is alerting. And we'll talk more about the effect of color, but that's alerting. And this is something that I've used with one of my patients. Remember to take your pills, and they check it off. We put it right on the refrigerator so that this person could see it whenever they walk by, and they would know that they took their pills. That is so much better than us having a caregiver say, oh, it's 2 o'clock, time to take your pills. That is enabling. That is not helping them to become independent as much as they can be. Make meals a social event. So many times they're eating in isolation. And use hot foods, cold foods, fresh herbs, different spices, see what it is they like. And we'll talk more about colors, and I think we mentioned this in my last session, the color red is very alerting. The color blue is comforting. So one of my patients who was refusing to eat and was losing way too much weight, way too quickly. Now, this didn't solve the whole problem, but we had a bright red placemat with a soft green plate. It focused him onto the food on the plate and removed all of the other stuff that you keep on your table. The candles, the pretty flowers, the salt and pepper, removed all that. So all he was focused on was that blue plate on that red placemat. Something as simple like that. It's not going to solve the problem, but it's going to help them be more independent and self-sufficient. The other aspect is as dementia and Alzheimer's progresses, many of them have hallucinations. My best friend, Jane, her mom, who I absolutely adored, she would wake up and she would tell me, I danced with, my husband last night. We had the best time. And she'd go and tell me about all these things that she did. And rather than correct her and say, Miss Kitty, your husband died years ago, I'm going to say, ah, that sounds wonderful. Acknowledge the fact that this is their reality. And as long as it's a pleasant thing, why correct them? Especially if they're in the last stages. Another example, my dear friend Carl, who had Alzheimer's, all his life he had a black lab. This lab was called Gossip. Every black lab he had was called Gossip. He developed Alzheimer's. It progressed very quickly. It was during the pandemic. So one of his friends bought him a stuffed black lab, stuffed animal, so he could pet it. And he talked to it like Gossip. And he would say, oh, I've got to go let Gossip out. Okay. That was his comfort zone. And there was absolutely nothing wrong with that, because that calmed him and made him feel good. So their world is not our world. And I think that's one thing that is hard for some caregivers to accept. They want everything to be correct. They want the person to recognize the world that they're living in. That's not the world this person is living in. So, make those exceptions and let those go. If it makes them happy and decreases their cognitive load, you're doing a lot more good than harm. So let's see. And really encourage music, art, any of the things that they used to like to do, because one of the other things that can happen with dementia and Alzheimer's is that the individual becomes apathetic and they just kind of shut down. And that, use it or lose it. You need to stimulate their brains in a way that's comfortable for them and at a time that's comfortable for them. So the other thing is behavior. Behavior is the most basic form of communication that we as human beings use. It's also the most effective form of communication. When you think back to a baby, what do they do to get attention? They cry. What does a toddler do to get attention? They throw a temper tantrum. So when these individuals maybe become aggressive, maybe are expressing an emotion that you don't understand where it's coming from, rather than say something like, everything's fine, I don't know what you're upset about, look closely as to the reason for it. When I worked with autistic children, I worked really closely with a behavioral therapist. And let me read this first, and then I'll talk about that. So if I have dementia and I'm upset, I've likely lost the ability to reason. The more you try to explain to me why my thinking is wrong or that I don't need to be worried, the more agitated I'm going to be, because it feels like you're not listening to me. The issue is they're not able to communicate what is wrong. And for us to say, there's nothing to worry about, is doing them a disservice. Because if they're worried, and there's a reason for it. So we go into the ABCs of behavior: the antecedent, the behavior, and the consequence. And what this takes is somebody to really sit back, don't be involved, and look at everything that's going on. See what's happening in the environment prior to the behavior. Write down what the behavior is and then what the consequence is. So here's a chart I'd like you to look at. Well, I'm not going to read it to you. Just let me know when you're done, because this is a true ABC chart that I did for one of my patients, along with her daughter. Anybody have any idea what's going on with this lady? Any ideas? No? It was really interesting. What her daughter thought first was she doesn't like having caretakers. And yet, some of the caretakers she got along with really well. What it turned out after doing this analysis and looking at everything that happened, the antecedent to each and every behavior was a caregiver walking in the front door. And this is what irritated the lady. She was finally, because we worked with her, myself and her daughter. Okay, is it the person? No. Is it what they do? No. And then she finally said, no knock. People were coming into her house, opening the door, making themselves at home in her house. And it irritated her. I don't blame her. I don't want somebody come walking in my house without knocking on the door. As soon as we explained that to the caregivers and they made an extra effort to knock on the door, hello, Mrs. B, can I come in? A lot of the behaviors decreased. I won't say they were gone, but a lot of them decreased. So it took really looking at the situation and figuring out what the problem was. And in her mind, they were invading her home, all these different people. So remember to focus on the why, not on the what. Not on the fact that she threw her coffee on the ground. Why did she do it? And also understand that it could be a reaction to stress. May have been listening to the news and it was too much of a cognitive overload or it was too negative. Put yourself in their place and look at their body language. That's a huge thing. One of the things that her daughter noticed is she would tense up her hands whenever the caregiver would walk in. And they would walk in all the time without knocking. And also to make sure that her basic needs were met. Make sure she's not hangry. So, first thing as a caregiver, I understand. I know this is upsetting. I know you're frustrated. Make sure that you let them know, you validate their feelings. Use the right body language as opposed to be very aware of your own body language and what you are projecting to them. Don't argue with them. We've talked about that. Accept what they're saying. Don't contradict unless it's something really important. Use the environment, engineer the environment. We'll talk a lot about that. When I was working with older, nonverbal, autistic adults, we set up a sensory room. And the facility I was working with kind of looked at me like I'd lost my mind. And they said, okay, well, we'll give you a room. That's it. You prove to us that this is going to work. So I had all of my coworkers go up in their attics into their hippie days and bring out, all the bubble machines and all the little glow things that they had and the fiber optics. And we set up a room that had all of these things in it. And we would go into that room when there was a challenge, when someone was really challenged emotionally, and it calmed them. And it just showed me how important the environment was for them. What happened, we kept our records because we wanted to prove that this worked. We had a crisis intervention team that would come and intervene when the adult became aggressive, and there were quite a few aggressive adults. There was a significant decrease in aggressive incidents when this room was used. So it just shows how impactful the environment is. Playing classical music, music that is familiar to them. And also, and we'll talk more about this, classical music tends to lower your heart rate, depending on the classical music that you choose. And go with their hobbies. Help them to continue to enjoy their hobbies. And pictures, especially pictures of things that have happened in the past. That's going to help. And I'll just give you a quick, let me see. I'll talk more about this app on the iPad later, but another individual that I was working with loved bird watching. And so for her enjoyment on this app called Pectillo, I put, nope, I touched the wrong thing. I put an entire app on here. This is a story about birds. Ah, gosh, I must be holding it in the wrong place. There we go. And what it did is let her okay. If she couldn't name the bird, all she had to do was tap the picture. And her daughter told me she will sit for hours and watch this storybook that I had created. What I did was I talked to her daughter and to her son about the birds that she was most interested in. And they gave me a list. I looked it up online, took the pictures and put it into this photo album, this talking photo album. And it calmed her. And she would listen to it and look at it and try and remember the names of these birds. So I was acknowledging the fact that she had a hobby that she truly enjoyed, but found frustrating. And each person is individual in what's going to be successful for them. And when they're upset, to give them time to cool down. And we'll talk about that too. One of the things is, okay, so I crocheted this for myself because it feels nice and squishy and warm. And when I had a patient and her daughter would call me, a lot of times it's the daughters. Her daughter would call me and say, Mom's really upset today. I put this on the side of the chair. And then I'm watching her do this. And she's calming down. I didn't have to talk to her about it. I just gave her the tools that I had been able to figure out with the help of her family of what would calm her. That tactile stimulation helped her to calm her emotions down. Sometimes it's so simple that we don't even see it, which is why, you know, we need to collaborate with the families on what's going to work. But allowing her that time, and what I would do with her is I'd say, I'm going to get you a glass of water before our session. And I would go in the kitchen and take my time and give her time to just de-stress before we started our session. Okay, another thing is music. And binaural beats is something that was discovered, let's see, in the mid-80s actually. And the theory behind it is if you introduce two sounds at different frequencies, the brain's activity will alter those frequencies and produce alpha waves, beta waves, or theta waves. And it's like, how can I explain it? Let me see if I have. Yeah, okay. So these are at two different frequencies. This works best if you have headphones on, but you don't have to. You can just have that noise in the room. But those two waves, in order for the brain to receive them, the brain alters them into a totally different frequency. And if you use the right frequencies, which you can find going online, it will create a theta wave, which is in a relaxed mode, or an alpha wave, which is more attentive. So you can use this music, this noise, to assist the individual to calm themselves and reduce their cognitive load. It's very similar to when you go to get a massage and they play the music in the background. A lot of people who do massages use binaural beats. It's not a song that you can sing to. There's nothing cognitive about it. It's plainly neurological. And it improves your overall brain function. So let's see. Can you hear that? Can you guys hear that? No? Yes?
Judy, when you go to hit the share button, there's a
Yeah?
little up arrow next to it. And I think that's where you can instruct them to play the music.
Oh, okay.
You see,
Where is it?
it's
Where's
all
your
the way, I think if I remember, it's over on the left. Here, just a second.
Okay.
Okay, so if I get into this, I'm going to turn you off. So I'm going to stop your share for 1 second, okay?
Okay.
And I'll see if I can find it. Let's see if I can remember it. Stop share. It's we have this.
If I stop my share?
Oh, okay. So click on share screen, and before you click on the item you want to share, at the bottom left there's a thing that says share sound, and you click on that. See it? So before you've clicked on share screen, and you'll see the blue share button on the right, and all the way to the left you'll see a little block that says you check it and share sound.
Let's see. Oh, wow. I'm not getting it. Sorry about that.
Shoot.
It's okay.
Did you see the share sound?
I see where it says, you
have to get out of share.
Okay.
Okay, so now you go back and click the share screen, the green button.
Okay.
And now at the very bottom of that, over to the left, you should see a little block that you can check that says share sound.
I'm seeing a microphone.
No, that's because you have to click on the share screen first.
I did.
And you're seeing a microphone? Oh no! See where it brings up where you can it's asking you what do you want to share now, right?
It just says share.
Right.
Share screen.
Okay, so click on share screen, and then at the bottom, it opens up a box, and it says share, and then you can go to your PowerPoint, right? But before you do that, you click on the little button that says share sound.
Yeah, I'm not finding that. I'm gonna.
Okay.
I'm gonna go back.
Okay.
Sorry about that, but if you do click on, if you do follow this, you'll be able to hear what's going on. I can hear it now. How do I turn it? Anyway.
Can you raise the volume? Maybe we can hear from what you're hearing.
Can you hear it? No. Sorry about that. Okay, so heart rate and classical music. The thing about classical music is most of it was written with the same beat as a typical heartbeat. When you have cognitive overload, your heartbeat increases. So listening to classical music will regulate your heartbeat back to where it needs to be. So that's another thing you can use. This is all about controlling the environment to make it so that the person with a neurological challenge is able to function, is able to communicate. So let's look at colors. And we did this last week. So tell me what color, what does that make you feel? How does it make you feel looking at the color red?
Warm.
Makes me a little anxious.
Yeah.
I think of anger.
Mhm.
I think of something really intense.
Exciting.
Yes. As opposed to the blue,
Calm.
which for me is calming. I'm thinking of the sea, I'm thinking of the sky. It kind of reduces my cognitive load. So all of this has been shown in many, many researches that the environment can be used to regulate how a person can deal with their cognitive. So green, making signs. Green is alerting. You're going to pay attention. A light green is calming. Red increases brainwave activity. They've proven this through mapping the brain and showing them different colors. It stimulates your appetite. It's alerting. Blue is restful, calming, reduces your blood pressure. So it also, this was interesting when I was doing the research. It offers a contrast so the weak person can easily identify their food. I just found that to be so interesting. Yellow. Yellow is very stimulating. It triggers cognitive function. A lot of times when I'm creating materials for people with communication difficulties, I will change the color of the background of the picture to be stimulating so that it will get their attention and get their focus going. Pink, okay, it comes in handy. People with aggressive tendencies. It's relaxing. Orange is a warm color, similar to red. If it's a bright orange, it can be very alerting. If it's a duller orange, it can be a natural environment. So, how do you adapt your environment without painting your walls? A blanket, pillows, and this is taken right from my favorite seat. Is a recliner next to my fireplace, and directly across from that is this picture. It brings back memories of my childhood, but it's also relaxing in its color. So I can focus on that. Little tiny changes in the environment can help people with their cognitive. And I know you know physical activity is really important. We talked in our last session how the vestibular nerve and the auditory nerve come together in a vestibular cochlear nerve. As you exercise, you're stimulating the neurons that deal with your ability to hear. It's true with other areas of the brain. If we remember that dementia and Alzheimer's is a global effect on the brain, any kind of exercise that you do is going to stimulate your cognitive function. It's going to stimulate those dendrites to grow, especially things that take balance. And even something as simple as rocking in a rocking chair will help. So any kind of physical activity that you can do. I particularly like the water therapy because I have a bad knee and a bad back. And this gives me, there's no pressure on my joints. But everybody's different, what they need and what they can do. Make it visual. So I I had another patient. This is the lady who had progressive aphasia, and her daughter started out on the right track. She would do little stick figures on a calendar, so her mom would know what was going on that day. So for the dentist, she would draw a little stick figure of teeth. And for me, she drew, I don't know what she drew. I think maybe she wrote speech on it. But she called me, the daughter called me one day. She said, I can't get Mom in the car. She's really upset. She doesn't know where we're going. I said, all right, I'm going to send you my picture. Show it to her. And as soon as the daughter showed her the picture of me, her mom got excited and got in the car. So what we think makes sense visually doesn't always make sense to these individuals. So this is the calendar that I made for her. All of these were Velcro, so you could use them for every month. But it gave her an exact picture of when she was going to go to Panera Bread, when she was going to have speech with me, when she was going to go to the doctor. These are actual pictures of the people that she was going to see. So she didn't have to go through that problem solving of, okay, that's a picture of lips and teeth. What does that mean I'm doing today? And making that association. That was too much of a cognitive load for her at that point in time. The other thing that I did with the daughter and the caregivers was she'd love to go to Panera Bread. She got the same thing every time because the caregiver ordered for her. And the caregiver said, I know what she likes. So I just went online and I found actual pictures of what they had to offer. I talked to the dietitian to make sure that these things were things that she could and should eat. And then I laminated it, gave it to the caregiver. The next time they went, she ordered something completely different from what her typical order is. And she ate it all.
Like a Chinese menu.
Yes, yes. So never assume that you know what they want. If at all possible, give them a choice.
Judy, you have 5 minutes.
Oh gosh, okay. Aromatherapy, I use aromatherapy all the time. In my office, I use peppermint because peppermint is stimulating. As part of my own personal nighttime routine, I use lavender because lavender is calming. So another thing you can do to control the environment is to use essential oils. Make sure that they're truly the essential oils. To have a background smell or odor that's going to help the individual. And here's just a real quick chart of all of the different smells. You can look this up online, but it really does make a difference. In fact, 2 weeks ago, one of my individuals, an adult with autism, came in, and I didn't have my diffuser on, I'd forgotten it. And he kept pointing. And finally, I realized he wants that smell in this room. So, that always affirms to me that this is important to them.
Judy,
yes.
One thing to be cautious of is if the patient has a pet at home, a dog. Some dogs can, those oils can, those diffusers can be, certain oils can be life challenging for the dog.
Yes. And I think that, yes, that's a really good point. Thank you. So, I only have minutes, so I'm going to kind of go through this really quickly. An ABC chart so they can spell out what they want. A really basic system where they can say yes or no, or I don't know, or stop. Just stop. Whatever works with your individual. Real pictures versus icons. Going sometimes just to the first then. First, we're going to go shopping, and then you'll get to watch your show. It helps them make sense. And my time is up, isn't it? Okay. These are recorded apparatus that you can use that will speak. All they have to do is push the button. It will speak for them. Gives them more independence because nobody has to look over their shoulder and read what they're saying. There's all kinds of different programs and apps. Text-to-speech has been very helpful for those people who still have lexical skills. And I know I have 1 minute left. And adapting things like the typewriter. Typewriter, that's old, okay. Your keyboard, You can get a large keyboard, plug it into any device. You can plug it into an iPad, a laptop. It can light up. It can help people who are having trouble with lexical things that still want to be able to write to do that. And, okay, gosh, I thought I wouldn't have enough to talk about. Here's some of the books that I have found helpful. Still Alice is a great, it's also a movie you can watch on Netflix. The ABCs of Aphasia, your previous speaker is the author of that. There's a lot of different stuff out there to help us as caregivers understand what these people are going through and understanding their mindset. It is 2:30. I made it.
Great job.
Sorry, I was
Coming from the lady who told me last Friday, you didn't think you had enough for another class.
give me a chance to talk and I'll talk.
Well, it's really, really helpful. And I'm glad that we will have this in our library because it really is, it's super, you know, last time you did this up in the room and it was very rushed because you were trying to put everything in and people were commenting as you went. And this time on Zoom, I think it is a lot easier and clearer and we'll be able to share it. You'll be able to share it yourself to some of your caregivers.
Oh, thank you.
Ideas. So that's you'll get a copy of it. Hang on to the link, and anyone who anyone you can share it to anybody because these are all free in our library. I'm sure all of us, as we listen, are thinking of family and friends who we know who've gone through this. Bob and I just went through this with our aunt, and Bob's sister and brother-in-law will be going through it with his aunt, or I guess his mother, when they go back out to visit in California. So lots of things here that we'll be sure and share this with them too.
We have our own personal to-dos also, like hearing aids.
Yes.
Yes,
Like
hearing
me
aids.
remembering to not holler across the house at Bob.
Thank you.
All right, well, thank you for the opportunity. I really enjoyed doing it.
Oh, thank
Thank
you
you.
so much, Judy.
This is really important. Yeah.
All right, bye.